Today I'm going to talk about problems with balance and dizziness, and specifically those related to problems with the ear. First of all, using this Adam-Ruili model, I'll talk you through essentially how the ear works. Firstly, the ear is related to hearing. Hearing works by this part of the ear, known as the pinna, picking up sound waves. It effectively deflects the sound waves down the ear canal, which hits the eardrum. This causes vibration of the eardrum, which in turn vibrates three small bones within the middle ear, the space behind the eardrum, and that stimulates the inner ear, which is this part buried deep within the bone. If I take this out and look at it in more detail. The inner ear has essentially two halves. This half, which we call the cochlea, this is the organ of hearing. So when sound waves hit this, which is the smallest bone of hearing, it will then cause a wave of fluid to pass within this part of the inner ear, which we call the cochlea. Within this part of the inner ear are very small hair cells, and that wave of fluid will cause bending of those hair cells, which is then perceived as sound by the brain. Those electrical signals that the cochlea forms are sent to the brain through this nerve, which we call the cochlear nerve. The inner ear also has this half, which is the organ of balance, the organ that is related to head movements and body movements. Basically, with regard to balance, our inner ear really is just a movement detector. When we walk down the street and look in shop windows and are able to walk across uneven ground, there are three main inputs into the brain that allows us to stay balanced. The primary inputs, which account for about 80 to 85% of our sense of balance, comes from vision, and a sense we call proprioception, which is joint position sense. So essentially when we're walking across an uneven beach, rocky beach for example, and our ankles are constantly moving over the uneven ground, those signals are picked up by the brain, which is then able to keep us upright and controlled. When we move our head against gravity, so either in the forwards, backwards direction, up and down, or rotation, that is picked up by the inner ear. The inner ear has 5 small organs within it. There are 2 organs that sit in this area here, and on the surface of these there's a small layer of chalk crystals or calcium carbonate crystals, and they provide weight against gravity. Beneath these are small hair cells, so when the crystals shift in one direction, they cause bending of these hair cells, which again will stimulate the nerve. The inner ear also contains these 3 areas, which are known as semicircular canals, and they contain fluid. These are placed at perfect right angles to each other, as we can see in this model, and therefore cover all planes of movement. The 2 organs here, which detect movement against gravity with those crystals of calcium carbonate, they detect movement in a linear or straight plane. For example, moving backwards and forwards or side to side in a horizontal plane, or up and down in a vertical plane, such as going up or down in a lift or falling. Rotational movement of the head is picked up by these 3 semicircular canals. They tend to be in this orientation. Therefore, this canal, or the superior canal, tends to detect movement going from side to side, shoulder to shoulder. This canal, or the horizontal canal, detects, as the name suggests, horizontal movement of the head, for example saying no. And this canal, known as the posterior canal, detects movement going backwards and forwards, so nodding and saying yes. It's actually orientated slightly like this, so it is just to one side, going up and down is the maximal stimulation. If we have problems with the inner ear, that can give us dizziness. Generally speaking, dizziness caused by problems of the inner ear is actually described as something called vertigo. What we mean by vertigo is an hallucination of movement, so essentially feeling like we're moving when we know that we are still. There are probably about 50 or 60 potential diagnoses that might affect us, giving us balance problems and dizziness. Some of these might be related to the heart, related to how the brain perceives what's going on, and related to blood flow and blood pressure. There are a number of conditions, however, of problems with the inner ear itself that can give us a sensation of vertigo or dizziness. We'll talk through a few of these common reasons. The first condition is something which we call benign paroxysmal positional vertigo, or BPPV for short. This is very common, and what happens in this condition is some of those small calcium carbonate or chalk crystals in this part of the inner ear become loose or detached. They can then float into the tubes in this part of the ear, the most common of which is this tube, the posterior canal. What happens then is when we move our head, even though the canal is picking up that movement and stimulating the nerve, those crystals floating within the fluid within this canal can sometimes stimulate the inner ear to make it feel like we're moving even though we are not. Classically, it predominantly affects this canal, which is the posterior canal, and if you recall, that is the canal that is stimulated in this position. Therefore, BPPV tends to affect patients primarily when they are lying down and turning over to the side of the affected ear, when they are looking up or when they're looking down. BPPV gives patients vertigo or a spinning sensation which tends to last just for a few seconds at a time when stimulated in that particular positions. If you're having this problem, it is best to seek assistance from your GP, who then will be able to refer you on to an ear, nose and throat specialist for treatment. Treatment of this condition is relatively straightforward with something we call a particle repositioning manoeuvre. That involves rotating the patient's head in a particular direction to allow those crystals to slowly float around this canal and drop back out again into a part of the inner ear where they should be. It can cure 80 to 85% of patients on one manoeuvre, but needs to be appropriately diagnosed in the first instance. Another condition that might give us vertigo that affects the inner ear is a condition called vestibular neuritis. In this condition, we can have a virus that causes inflammation of this part of the inner ear, which is the vestibular nerve or the nerve of balance. That will often make us feel very, very dizzy and vertiginous, and that vertigo may last for a few days to even a couple of weeks. Patients will often feel that there is a constant spinning and all movements will make them feel worse, and they will often be vomiting and very nauseous. Basically, because this is a virus, a little bit like a cold, we just have to wait for it to settle. But your doctor may be able to give you some medication which will dampen down the intensity of the symptoms for the period of the condition until it is fully resolved. Another condition that can affect some patients, albeit rare, is a condition known as Meniere's disease. In this condition, we can get inflammation or too much fluid buildup within the whole of the inner ear. In that respect, it affects not just balance and dizziness, but it can also affect our hearing. Classically, with a condition such as Meniere's disease, patients will have attacks that last for minutes to hours, and what happens during an attack is their hearing will drop. They will describe a tinnitus or a buzzing sound in their ear, and they will get acute vertigo, a spinning sensation that lasts throughout that length of the spell. There are various different treatments for Meniere's disease, but it has to be diagnosed appropriately. It is often misdiagnosed in a large number of patients. To that end, what patients would need would be a series of hearing tests and an assessment by a specialist ENT surgeon. A very common condition that actually doesn't really affect the inner ear as such, but affects the brain, is a condition known as vestibular migraine. This can often mimic Meniere's disease and classically will give patients a vertigo sensation, feeling nauseous, possibly vomiting, which can last anything from minutes to a few days. Patients may or may not have headache with this type of migraine, as it is one of the many types of migraine that don't always give patients headaches. Again, this condition needs to be appropriately diagnosed and treated, so if you're having any dizzy spells or vertigo that is going on for a period of time and not settling, it's always best to see your own doctor and potentially have a referral to an ear, nose and throat specialist with an interest in dizziness and balance. I hope that is helpful in explaining how the ear can give us problems with our balance. Any concerns, always see your doctor. Thank you.